So the topic that I'm presenting is how fathers, how the coronavirus has affected fathers' involvement in Germany, and it's a joint project together with Sabine Zinn from the German Institute for Economic Research here in Berlin. Before I present the results from our investigation, it's good to give you some country context, particularly if the outcome variable is gender roles and gender role behavior. And now I thought it was frozen, but it's behaving. So I think most cross-national studies usually Germany is typified as this conservative male breadwinner regime. But I think it's very important to note that very important reforms have been brought on the way in 2005, the expansion of public daycare in 2007. Parental leave benefit reform, this was really a game changer. And there are some studies that have evaluated the effect of these reforms, and they show that fathers have become more involved and that mothers, in particular full-time employment, has increased. But nevertheless, they also show that changes are very slow. And one could argue that it's really a tender plant that is growing in terms of fathers' involvement and the joint division of care. And there was a concern that this tender plant could easily be killed by a strong period effect, such as the corona crisis. And that is actually the discussion that we had in the public media very much. That was picked up that the corona crisis could have the power that would bring us back into the 1950s. And you see here on this slide, Jutta Almdinger, she's the head of one of the leading research institutes in Germany. And she proposed that the corona crisis could lead to a retraditionalization, so in German, Retraditionalisierung in behavior. And we have wanted to contribute to this discussion by trying to test this retraditionalization hypothesis. And the idea would be that the corona crisis would have fallen squarely on the shoulders of the women and has led to a very unequal division of care, or even more unequal than we already have it at this before the crisis. However, in the early morning session, we have already seen some very interesting findings on how women and men actually behaved very differently or were affected differently depending on the type of occupation. And we have very similar findings for Germany that actually show that the corona crisis has affected male-dominated fields more strongly than women's, that frontline workers in health and in the trade, that these were more often women. And we also have very recent evidence from the German Institute for Employment Research that short work, which was very prevalent very quickly in Germany, that men were more affected by that by women. So the retraditionalization hypothesis could be opposed actually by the hypothesis that the corona crisis could have been a push for gender equality, and that certain types of men were more likely to actually take advantage of the time that they have at their disposal and have taken more care of their children. And these are the competing hypotheses that we are following in our investigation. When we started our project, there was not so much research going on. There were only convenience samples available at that time. And at least in the German case, there is a lot of discussion how reliable the convenience samples have been and how trustworthy the results are based on these analyses. But apart from the convenience samples, there are also the big family panels and the big panels that went into the field very quickly after the lockdown. The only data set that immediately went into, or the only big panel that immediately went into the field during the lockdown, is the German socioeconomic panel. And these are the investigation that we use. This is the data that we used for our investigations. So the good thing about the German socioeconomic panel is not only that it has information during the time of the lockdown, but of course also that it's a panel, so we can trace people across time, so compare their behavior shortly before the lockdown with the behavior after the lockdown. And this is also what we did in this paper, and we focused on one outcome variable, that's time that mothers and fathers spent with their children, and compare the patterns before the lockdown with the situation during the lockdown. The investigation is very simple. So we focused on cohabiting unions with children below age 12, and we have about 1,000 parents in our sample. And it's a very simple model where the outcome variable is just the difference in care work between 2019 and 2020. We also did some more fancy modeling, fixed effects modeling, but I will focus on the simple modeling strategies in this presentation. So to give you some descriptive findings first, before I move on to the model results. So these is the childcare time spent spent by fathers and mothers before the lockdown in 2019 for women and men with children below 11. And this is also a pattern that you find with the time use survey for Germany. So mothers shoulder most of the childcare burden. It's more than double. So it's very unequal. It was unequal before, but nevertheless, in a longer time perspective, it has become a bit more equal. So unequal, but a little bit more equal than in the distant past. So if the retraditionalization hypothesis would apply, one would assume that childcare would fall squarely on the shoulders of mothers. So the additional childcare time would, during the lockdown, would disproportionately fall on the mothers, but this is not really what happened. We see an absolute increase for both mothers and fathers. And in absolute terms, it's the same for both, but in relative terms, because men start at a lower level, the increase is a bit stronger. It's not a bit, it's substantially stronger in relative terms for the fathers. So how do patterns look like by socio-demographic characteristics? So we address that in the linear regression, where the outcome variable is a change. And there are some findings which are generally expected. We see that particularly parents of preschool children, they had really to invest more time in childcare, which is what one would generally expect, because public daycare were closed and children of that age need more care than school-age children. But there were also some findings where we thought that is actually a surprising result. Generally, and these were particularly the findings by level of education, we generally, at least in the German debate, there is a lot of discussion about highly educated men being the vanguards of more equal ideals of new fatherhood. So that they would be the vanguards also in stepping in and taking care of their children during the Corona crisis. On the other hand, we also know that actually the lowly educated, medium educated men, they had more time because they were more affected by short work. And this is actually what we find, that counter to this idea of highly educated men being the vanguards of modern behavior, we see actually that the lowly and medium educated men have expanded the time with their children. On the one hand, one can say, well, they had more time, so why not spending it with their children? On the other hand, we have studies from the 80s and 90s which actually show that even if men become unemployed, they do not necessarily spend their time with their children or invest that into childcare. So we have tentative evidence that this Corona crisis operated differently and maybe pushed some men towards a greater involvement with their children. And these are men that we usually don't have on our radar in terms of new fatherhood. So what are our tentative conclusions from these very descriptive investigation? And I think the investigation shows again that we have very unequal division of care load in the case of Germany. And the Corona crisis really highlights that again. It's unequal. It was unequal before, and it's again very unequal, but there's not really a very strong indication of a retraditionalization. There's more an elevator effect. The lockdown meant an increase in childcare time. That was very similar for both men and women. But of course, this is only average. There's a lot of effect heterogeneity. We focused on differences by means education, but of course there are other differences that one can think of. But nevertheless, I think it is interesting to see that medium and lowly educated men were the ones who really changed behavior. And some can be probably attributed to short work and the type of industries that they're working in. And with this, I'm actually already coming to the main limitations of our study, that we have 1,000 individuals with small children, but it's a small sample in the end, and we cannot really zoom into different industry branches and different constellations. So that is certainly a limitation, and furthermore, fine-grade investigation have to follow to unravel the more fine determinants. And of course, we only looked into couple behavior, and that means we also neglect a large fraction, that is the lone and the non-resident parents from our investigation. And we only looked into time use, not division of care work. But there are now further studies with a German family panel, which only have retrospective information on how people shared their care load during the Corona crisis, but they very much support our findings here of an elevator effect. But of course, there are a lot of further limitations one can think of, and a big limitation of this type of research is, of course, that it's only subjective time use. We don't have a very clear idea of whether people lie in these surveys, give valid reports, and how that differs by gender, how people spend their time, and whether fathers do more often multitasking, taking care of their children and doing other things at the same time. So also here, I think other type of research, like qualitative research, will unravel what is really behind this. But I hope, nevertheless, with our study, we provided some insights into how Corona crisis affected fathers' behavior and gender roles. And I'm done with that presentation. Thanks for your attention.